Okay, so we're going to be talking about autism, and the general, overall question that we're going to be focusing on is, are the challenges faced by those with high-functioning autism a function of individual impairments or societal norms? So we're going to start with a story. These were horses that were drawn by typical 6-year-old children when they were asked to draw that. These are horses drawn by Ithaca College physical therapy students when they were asked to do the same thing. This is a sketch by an artist named Rembrandt, who was a painter, and he also did different sketches and drawings. And these two pictures were drawn by a young girl named Nadia. The picture of the horse she drew when she was 5 years old, and the picture of the pelican she drew when she was 6. So Nadia has autism, and when she was younger, she couldn't really verbalize or communicate. And then one day she picked up a pencil and she started to draw, and this is what her drawing evolved to. And she was compared, as in her early stages, to the works of Rembrandt.
Autism, or now formerly known as autism spectrum disorder, is diagnosed in 1 out of every 68 people. It is characterized by difficulties with social communication and restricted patterns of behavior. Some of the behaviors a person with this diagnosis may exhibit in a social situation includes difficulties with eye contact, difficulties adjusting their behaviors to appropriately match different social situations, and difficulties understanding nonverbal communication. Some other restrictive and often repetitive patterns of behavior include repetitive motor movements, such as lining up toys, the need for strict ritualized patterns throughout the day, such as the need to eat the same exact foods every single day, or they may have a perseveration on a specific topic or object. Although people with this diagnosis may have a great talent, such as Nadia's artwork, these other behaviors are considered clinically significant because they are said to impact the individual's social and occupational function. So autism spectrum diagnosis is typically diagnosed at a young age, but nowadays it can be diagnosed later in life when the social demands become greater and the individual isn't able to cope, so these abnormal behaviors become more evident. In the days of the DSM-4, there were many diagnoses that now fall under autism spectrum disorder, including Asperger's syndrome. People with Asperger's syndrome are said to be high-functioning people with autism, and they are often able to hold jobs, but they report a lot of difficulty obtaining those jobs. So try to imagine the judgments that an employer might make on a person with autism who's coming to interview, who avoids a handshake and doesn't make a lot of eye contact. It's easy to see how, in today's society, this person may not get the job due to these differences in social communication.
So for the past 25 years, a growing number of autistic individuals have begun calling for societal change. This movement, coined Neurodiversity Challenges the traditional medical model of autism, and is really based on 2 tenets. First, that autism is a natural variation found among humans, and that those with the diagnosis simply display a different way of thinking than all of us neurotypical individuals. Second, that society should work to increase the rights, access, and acceptance of neurodiverse persons, because a poor person-environment fit may be more to blame for individual difficulty than characteristics of autism itself. So, one example of that is actually person-first language, a person with autism. We have been taught to identify illness in a manner that preserves the individuality of the person suffering from the condition. But what if autism is part of the person? What if it's not something to be separated out? And what if that person isn't intrinsically suffering? So the former ideology has led to a lot of research regarding treatment and prevention of autism versus accommodation. And so one of the results of that research has been a technique called applied behavioral analysis therapy, or ABA. And ABA uses a systematic approach to modifying behavior using principles of learning like positive reinforcement and modeling. And it's actually shown a lot of really great benefit in modifying behavior that falls outside of societal thresholds, like self-injury and inappropriate public outbursts. But one of the critiques of therapies like this is the amount of energy spent trying to normalize behaviors, such as a lack of eye contact, a lack of interpersonal touch, a lack of small talk, etc., that may result more from public discomfort than individual discomfort. And if this is the case, should we really be trying to normalize these behaviors which may not negatively impact the individual? So, a final point of consideration is the negative stigma that accompanies a diagnosis of autism. Owing partly to the way we view autism is a condition necessitating medical treatment, partly to separate classrooms, and largely through a lack of understanding. Do our negative perceptions of this condition negatively impact those with a diagnosis of autism more than the characteristics of autism itself? Jeffrey Bowles said that attitudinal barriers can lead to social isolationism, underemployment, and discrimination. And actually a further study of those with high-functioning autism revealed that they felt strongly, 83% of them felt strongly, that a lack of understanding by neurotypical persons was a significant barrier for them on a daily basis. So I think that these struggles can be partly paralleled by the recent struggles faced by the LGBT community. Numerous attempts were made to cure homosexuality or force identity change on those who identified as LGBT, and all of these efforts had devastating results and impacted all dimensions of wellness greatly. I think recently we've been doing a lot better in acceptance of this specific deviation from the norm, with a lot of positive benefit for everyone involved. So with this new idea of neurodiversity coming to light, I think it's time that we examine our own ethnocentrism and ask ourselves, what can we do to better our environment and help those with a diagnosis of autism? Because maybe we find that behind it, a condition that we originally thought was horribly debilitating is actually just a unique way of thinking that when fostered in a friendly environment helps us all grow as people.
So today we do have the ABA, as well as we treat autism with antidepressants and anti-anxiety medications. All of these are used for the same purpose, and that is to help the child become part of our neurotypical world. And usually we do give these medications. Yes, there is a time and a place for these medications to be used, but that's first when all the holistic approaches have been tried and the child is still not able to have any success within therapy. But when actually interviewing the autistic people who have had medications, they comment upon it saying that it's more of a sedation technique, that they feel like they're within a straitjacket, that they're confined within their bodies and they're not able to explore the world that they once used to through their mind. So when is the time that we actually give an autistic child medication? You've probably seen a little 5-year-old being given a plate of broccoli, maybe even you yourselves, and your mom tells you to eat it, but instead you threw a temper tantrum saying, I don't want to eat that, I will not eat that. Well, an autistic child will also throw a temper tantrum if they're confused, stressed, or maybe they're uncomfortable in the environment that they're given. So what's the difference between a neurotypical child throwing a temper tantrum, communicating they don't want to eat that broccoli, or a neurodiverse child telling us that they don't want to be in this environment, they're uncomfortable? Autism in children, they can continuously communicate with us in a temper tantrum. And that's one of their ways that they say to us, we're uncomfortable. So in that light, do neurotypical people have these attitudes where they judge people based on their stress or their confusion? Today we probably all have stress and confusion. It's part of our daily lives. So when a person is diagnosed with autism and we recognize that diagnosis, does that make us judge them harsher when they feel that extra stress or that extra confusion? Why don't we try to integrate our two worlds, the two worlds of neurotypical and neurodiverse? Why don't we make it a two-way street where we learn to communicate with them and have them communicate with us? Through the ABA, we find this problem that autistic kids cannot look us in the eye. But have you ever had a friend who can't look you in the eye? You probably brush it off like, oh, it's some quirk that they have. But once they have the diagnosis of autism, you say that we need to fix this because of the ABA. Why do we need to do that? Again, why don't we create a two-way street rather than just a one-way, making a neurodiverse person become part of this neurotypical world? So how do we hone in on that as a physical therapist student? Well, maybe we discover what they're really special, what their hobbies are, what their interests are. Be sensitive and flexible with them. Maybe if the child loves to paint, have an easel at physical therapy, but to work on balance and coordination, have them stand on one leg. That way they're still doing what they love and how they communicate. Or if the person that you're working with is a super mathematician, have them draw the numbers a little bit bigger, work on that wrist flexion, extension, all that stuff so that you're really working through physical therapy with them. Maybe you can even create an environment that makes them less stressed, have it less noisy, less distracting. That way you produce an environment where they can be successful. And even we can have them participate more so that they can participate in the home, school, and community.
So going back to Nadia, who we talked about in the beginning, she was sent to a school where she was learning to develop her interpersonal and verbal skills, and she worked really hard at it over time. She started being able to do that better, but through that she lost her love and her talent of communicating through her artwork. So as PTs, we will be working with patients who are along this neurodiversity spectrum, and they might not always be able to verbalize what it is that they want or need, but they will find a way to show us, and we just need to be able to recognize it when they do.